Senator Isakson.
Thank you, Chairman Alexander. Thank you all for your testimony. Mr. Lindenberger, what year in school are you?
I am a senior in high school.
When did you start doing the investigation and research on vaccination?
So for my mother specifically, I mean, she would vocalize her views on vaccines throughout my entire life. And it was a slow progression to start to see evidence as I would see people, try and counterclaim with her and argue online. I would see that she would have this backlash as she would share information. So on Facebook, she'd share a video and people would be like, that's incorrect, this is false. And so as a child, that intrigued me, that people disagree with my mom, and I slowly looked into it over the course of multiple years.
That's the second time you've used online in your answer. I want to add, does your mother get most of her information online?
From what she's presented, yes, either through Facebook or through sites that use the social media platforms like Facebook and other, mainly Facebook.
Where do you get most of your information?
From not Facebook. I mean, from CDC, the World Health Organization, scientific journals, and also cited information from those organizations like the Institute of Medicine. Trying my best to also look at accredited sources.
I'd love to be a guest at Thanksgiving dinner at your house. That'd be a heck of a discussion everybody would have. I know that. Dr. Omar, thank you for being here, and thanks for the work that Emory does. Emory does a phenomenal job in infectious diseases and all kinds of things like that. What currently, are there any things on the horizon that would join this group of people that we might want to be immunized for later on?
So there's several exciting developments, and one of the big gaps in vaccine has been the fact that there is a gap of vulnerability between the baby is born and when we start vaccinating them. And that's due to immunological reasons. And one of the more exciting developments in this area is the area of maternal immunization, where you vaccinate mom, and I had the privilege of being involved with some of those trials, et cetera, to protect not just the mother, but the baby as well. So there are vaccines against the respiratory syncytial virus, which is the biggest cause of viral pneumonia in the world, that are on the horizon. So there's a variety of vaccines being developed. There is a vaccine that is being developed against group B streptococcus, et cetera. So there are several vaccines on the horizon. The field is expanding.
Now, would those vaccinations take place in the mother before the baby is delivered?
Yes.
So it transfer to the baby during the course of gestation?
Yeah, exactly. And our first trial was had a name of Mother's Gift ages ago, and I think it's an appropriate name for this kind of a strategy where maternal antibodies protect the baby.
You know, I've been to Africa with CDC a number of times and seen your work, the work in the field that they do. I don't know of any organization that does more for healthcare in our country than CDC does. How much do you use CDC for as a resource in your work at Emory?
A lot. So CDC is a national treasure. And the firefighting function that I talked about, they perform with the state and local health department, is somewhat unique. For example, the European CDC is relatively new and has a very narrow mandate. And people who have looked at the effectiveness of national public health agencies in Europe have clearly come out with the understanding that our CDC is very strong, and I'm not trying to put down any other country's public health agencies because they are trying their best, but the kind of investments that have gone into building this cooperative framework of the CDC being the premier technical public health agency, but working closely with the state and local health department has served us really well, including in this area.
I don't think you're putting them down at all. In fact, to tell you the truth, it's the world's healthcare center at CDC, and we are lucky to have it in the United States of America, but the world considers it their health center, and they're doing a better job. CDC is doing a better job incubating CDCs in other countries now to replicate what they do in countries that are more developed and populated. So they're a great resource, great help, and great service. And I thank all of you for being here today. And Ms. Lindbergh, don't forget, I'd love to come to Thanksgiving dinner one day and just meet you in your office.